Hello, my name's Ken Kinter. I'm an assistant professor at Rutgers University. And the purpose of today's presentation is to discuss burnout, compassion fatigue, and grief. As usual, my contact information is on this front slide. Before I get started with this presentation, I want to give some credit where credit is due. I work for the State Hospital Psychiatric Rehabilitation Initiative, and our mission is to improve the conditions and care in New Jersey state psychiatric hospitals. This would not be possible without the generous help from the New Jersey Department of Health. Their financial and other types of support make our mission possible, and I'm very grateful for them for their support. So today, hey, pardon the background here. This is about some rather depressing topics, and I always try to bring a little bit of cheerfulness in here. So the theme of the background for these slides is no rain, no rainbows. So what we're going to be doing in this presentation is describing burnout, compassion fatigue, and grief, and along with providing a lot of different suggestions for helping cope. So first, we'll start by talking about burnout, a state of exhaustion caused by long-term exposure to demanding work situations. And I love this quote from a friend of mine, Dave Mueller: "There's more going out than coming in. The well doesn't have a chance to replenish." Now, compassion fatigue comes from working with people or animals in distress. In short, it's when we're working with things that are wounded or hurt, we give a little bit of ourselves to that person or thing, and we take on a little bit of their pain. And the more of this you do over time, and the more significant those stresses are, it's almost like a backpack starts to fill up and there's this weight of things in there. And it's where the term secondary traumatic stress comes from. You may not have been through trauma yourself, but when you work with people who've been traumatized or have some sort of hurt or pain going on, just from a perspective of being human, you take on a little bit of that. And if we don't see to that or help that, that becomes a burden that helps us with, it hurts us from taking care of ourselves and from helping other people as well. So lots of stuff in here about how compassion fatigue looks. There's a lot of cognitive and emotional and behavioral. Basically what it does is it impacts every part of our life. If we don't care for the part of our life where we are suffering, whether it's due to burnout or compassion fatigue, we don't take care of ourselves. We're not fully present for the people around us, and we probably don't do our jobs very well. And there are times, and this is being recorded during the time of the COVID-19 pandemic, this is a time where a lot of that kind of suffering is going on. So now compassion fatigue and burnout sound very similar, but they aren't exactly the same. Burnout is much more about the routine of the organization. You've got to do the timesheets, showing up, the commute, all of these sort of physical, tangible aspects of the job. The compassion fatigue is the part that hits us with dealing with people that are having trouble or suffering, and us taking on some of the suffering of others. So after a while, our suffering becomes so full that we immediately start to protect ourselves. We're so vulnerable that we kind of put up a wall to protect us from the suffering of others, so it doesn't remind us of our own suffering. We see a lot of this in trauma work. So there are things that can make you more at risk for compassion fatigue and burnout. And one is if there isn't a really good work personal life balance, if there isn't much of a boundary in between, if my work is my life and my life is my work, that makes somebody very susceptible. If we're overachievers, that becomes difficult. If the job is really repetitive, sometimes that can lead to boredom, and then that boredom leads to lack of caring. Working in the helping professions, we are as guilty of this as anyone, those of us who work in this field. We want to help everybody and accept ourselves on occasion. So other signs: do you catch yourself pulling back emotionally from your job, being more cynical, being more critical, being more sarcastic, less joyous? Do you dread going to work? A colleague of mine I used to work with would pull over in her car and vomit at the side of the road before going into work. How effective can you be in your job if that's the level of dread you feel about going to work? More irritability, less patience. Do you feel that work is insurmountable? And in truth, it may be insurmountable, but it's the feeling that it's too big and I can't fix this. That's where the challenge comes in. Do you feel energy being drained away? Like it's just some droning routine on and on. There's nothing new or fresh about it. Do you not take satisfaction from your achievements? When something good happens, do you just automatically discourage it because there's this real focus on the negative? This one's one of my favorites. Do you have a hard time laughing at yourself? To me, if you can laugh at it, you've beaten it. If you can't laugh at it, it's beaten you. Are you tired of your coworkers asking if you're okay? If you've heard it from more than one coworker, you're not okay, regardless of what you're saying. Do you feel disillusioned about your job? Like it's not the same as it was when I got here, or that feeling of disconnection? Are you self-medicating to either feel better or to not feel? And self-medicating can be pretty much anything. Have your sleep and appetite habits changed? Or are you troubled by various types of physical pain? So there are many causes due to this. If you feel like your job is beyond your control, you have no way of controlling the amount of work that's coming in, that's a potential cause. Unclear expectations, where you feel like your job is changing all the time and you don't know what to expect. Sometimes that's actually the lure of a job. I worked in emergency room settings for a long time, and the unpredictability was a blessing for many years, but after a while, I also caught myself wanting a little more stability. Dysfunctional workplace dynamics. Do you have problems with boss, problems with coworkers? Other causes. Does your job reflect your values? Or is it contrary to who you are as a person? Does your job fit well with what your skill set is? Well, very often people have a job where they fit their skill set and then they get promoted, and that promotion may not fit their skill set so well. Extremes of activity. This is another ER thing. You're either running 100 miles an hour or not at all. Some people love that. Some people find that very stressful. Some of us loved it when we were younger and didn't love it so much as we got older. I'm sure there are many other causes. What causes do you have at your job about burnout? The structural aspects of the job, and then what parts of compassion fatigue strike you? The other piece to add about compassion fatigue is not each person that we deal with hits us the same way in terms of compassion fatigue. Sometimes if there's a connection, if that person reminds you of someone, there might be something about that specific case that strikes right at your heart and who you are. So compassion fatigue can be impacted disproportionately by different people. So that's something to keep in mind as well. Who are the people that you connect with that might have that, increased risk of compassion fatigue for you? Now, we have a lot of suggestions here about what you can do about this. First and foremost, remember the value that you have. If you're seeing this, you probably work in a helping profession or in mental health. You're helping sick people. You're helping people that don't have something, and you're helping them to get it. That's a beautiful thing. Perspective. I love the, plan for the worst, hope for the best. Belonging. What groups do you belong to? Isolation is a very difficult thing and makes all of these things worse. So how do you connect with people, whether it's colleagues or coworkers or people outside of work altogether? Acceptance. Acceptance does not mean agreement. Acceptance means this is the way it is, and I will be working with that, whatever that is. Doesn't mean it's okay with me, but it just means acceptance. Support, as we talked about already, talk about this, let it out. So the only way to work out things like burnout, compassion fatigue, grief is to be able to talk about them. Growth, do something different, change something tiny about your workspace, change something about what you do. I changed hours in my job, the exact same job, and it made all the difference in the world. It just changed the way I structured my day. So suggestions, first of all, be honest with yourself. And am I burned out? Do I have compassion fatigue? And separate the two. How much of this is burnout and how much of this is compassion fatigue? Many people change jobs in the same field. That's because of the burnout. It's the specifics of that particular job. When people leave the field, it may be more due to compassion fatigue. Don't deny, don't minimize, own your symptoms, own what's going on. There's something called the personal chaos inventory, or PCI. This is a really nice way of sketching out what your symptoms are when you're under stress. What are the causes? And again, we were saying before, start with one thing. Pick one thing and change it. These next couple suggestions I'm a big fan of. I'm a big believer in the commute to work as therapeutic time. Have a meeting with yourself. Plan your day. What are the priorities? What do I want to get to today? And part of that is also reviewing the gratitude list. What am I grateful for? I'm alive. I have a home. I have a car. I have my health. I have a job. These are all beautiful things. And when we're in that burnt out, compassion fatigue place, we ignore the good. We lose that balance between good and bad that so much of life is. The counter to this is, before going to sleep, remember at least one good thing that you did and one good thing that happened to you that day. Where was the sunlight in your day? And it can be anything. If you held a door open for somebody, whatever it is, nothing is too small. Because what happens is, once you make this a habit, then you're immediately looking for that good thing. I want to get that good thing in, whatever that is. I want to get at least one in during the day. Meet with coworkers and supervisors when you're stuck. Don't tough it out yourself. Don't forget that the work you do helps others who sorely need it. Own that maybe some of these things that we do at home aren't the most effective stress relievers, fast food and TV, all these things that are immediate gratification. They're substitutes for self-care, but they're not self-care. Ask the people around you, what do they do for stress? They may be in the exact same boat that you're in, and there may be something you can do to help them or they can do to help you. And are there something that you've done for stress that you were doing that you're not doing now? A very common example of this is spirituality. People immediately start to detach from their spirituality or creativity when they're stressed, and those are things that replenish the water in the well. Could there be more suggestions? Yes, there are. There are many suggestions. The Serenity Prayer, I'm a big fan of that, whether you include the God part in it or not. It's a great way to look at life. What can I change? What do I have to accept? What's the difference? Self-care regarding diet and exercise. Again, reinforcing making the little changes. And one of my other favorites, and as a therapist, most of what I do working with people is reconnecting people with their joy. What are the things that bring them joy? And how can you do more of them in your life? Spend more of that time in joy. So now moving on, we're going to talk about grief. Grief is a unique process. It's different to each person, and it's different for a person each time they go through it. Typically, bereavement is a type of grief involves the death of a loved one, but as we're going to talk about, grief can be multifaceted. There's lots of different aspects of grief besides bereavement. And I love this. Grieving doesn't make you imperfect. It makes you human. Everyone has to deal with grief. We all lose things during the course of our lives. So lots of things can influence a grieving process. Our own background, particularly what trauma or loss we've had before. Each time that we grieve the loss of someone or something, the losses of other things and people past always come back again. It never fails. Every time I'm at a funeral, I think about all of the other people I've lost along the way, and I'm re-grieving them. Each opportunity is another opportunity to go back and look at that grief again, and that can either compound the negative impact of it, or it can actually be adaptive. What are your spiritual and religious belief systems? Aspects of your own personality? What was your relationship like? How close was this person or thing to you? The age that a loss is experienced is important because it depends on where your developmental stage is, how a person deals with it. It's always interesting to watch people of different ages dealing with the loss of the same person and see how they process it. The support systems. There was a study that I should track down that said one of the main determinants of whether somebody grieved well was how many times did they get to tell the story? How many people did they have to talk to about it and just get it out, get the emotions out that are in? And the last part of this is, are there any hooks that make this loss particularly difficult? Is there something about a loss that's particularly galling? One of my clients recently went through a really tough time. He adopted a puppy, and then the puppy got really sick, and he thought he was going to lose the puppy. And it was really upsetting to him because the puppy didn't even have a chance to grow up and be a dog. And he was also very concerned that it had something to do with his care. Now, the puppy ended up being fine, which is a beautiful thing. If it was an older dog, it wouldn't have been as difficult. It still would have been difficult, but not as difficult. So is there any hook? Is there anything in particular, if someone passes it's close to you and you had a conflictual relationship with them, that might make it harder to do the grief and move past? So complicated grief is a type of grief. It's about 15% of most grief experiences. And it's when, we were talking about the hooks before, it's when something comes along to make that grief worse. So it just doesn't go away. It's understandable when somebody loses someone or loses something and they spend a month kind of grieving that loss, but they go down into it and then they move back out. Complicated grief is more complicated. The connection is still there. There's no focus on the future. It's either non-existent or empty. They still think the person or thing might reappear in their life again, and the idea that they can't make it without that person. So again, what made that grief complicated? What is it that set this up? And complicated grief involves someone's thoughts, feelings, and behaviors, and all of those will have to be involved to help the person get through the grief. So something that we've been seeing a lot lately, and again, this is being recorded during the 2020 pandemic, anticipatory grief. Anticipatory grief is interesting. You haven't lost something yet, or it's the perceived loss of something. So right now, as I sit here, people are grieving. They're concerned about their financial losses, the social losses, the loss of things that they were able to do that they can't do now, loss of security, perceived loss of health. What would happen if somebody gets sick? This tends to center on death. It's really about loss too. And anticipatory grief looks a lot more like anxiety than depression. After someone experiences a loss, they go through a depression. This is like this feeling of anxiety. What am I going to lose? Is this going to cost me my business? Is this going to cost me my job? I'm going to graduate and I'm not going to be able to walk. So it's the perceived anticipatory loss of all of those things. So I'm guessing you're off, and we're going to talk a little bit more about that coming up. So Kubler-Ross, the very famous stages of grief: denial, anger, bargaining, depression, acceptance. And then just within the last few years, that was reevaluated, and in her work with David Kessler, they came up with finding meaning. Now, I think this is great because I don't think acceptance is necessarily a great place for closure. As I mentioned before, acceptance doesn't mean I'm okay with it. I just acknowledge that it is what it is. I like the idea of finding meaning. How do we incorporate this loss into who we are? You know, the sum total of that relationship. When you realize, all right, what was the net benefit of that person being in my life? I think Dr. Seuss has that great saying, don't cry because it's over, smile because it happened. So I think that sort of captures it. How do you work this into the meaning of your life? Now, Kubler-Ross's stages have been criticized over time, groundbreaking and absolutely foundational in grief work. But we don't move linearly through them, and sometimes we're in multiple stages at once. Strobe and Schutt illustrated that it was more about cycling through these various states. There's a time to cry. There's a time to be angry. There's a time to mourn and wish that person was there. So we just cycle through these experiences until we come out the other side. It's a different way of looking at grief. Worden's tasks of grief starts off with accepting. We start off in this denial stage. 1 is accepting the reality of the loss. 2 is working through the grief. What do we need to do to be able to get through that pain? Adjust to the new environment without the deceased in it. So now we're looking forward into how am I going to go from here? And then I think this part's really interesting. Emotionally relocate the deceased and move on with life. So do you view that relationship is over, or has it just changed in some way? It's a really important and really individualized way of looking at it, but it's necessary for putting that into the past and then being able to move forward. So I love that idea of emotional relocation. It may not be where that person's body is. Person may feel they're carrying them around with them all the time, or there's a specific place, something along those lines. And then there's rituals that involve with that. So there's many ways to help deal with grief. Most of it involves just getting it out in an individual setting, in a group setting. Something that's very short-term and intensive can very often be helpful. Looking at what other things the grief conjured up for you, and rituals for dealing with the loss. And here are some of these rituals. Rituals of continuity. How do we keep this person in our life? Transition. How do we handle the transition from that person being physically with us to being gone? Affirmation, being grateful for having that person in life in the first place. And intensification, where this loss actually makes the group grow stronger. There are many different ways of memorializing someone. In different religious traditions, they've built this in, whether it's celebrating or acknowledging on the anniversary of someone's death. I'm a big fan of planting the tree. I adopt a lot of animals, and when they pass, I end up with all sorts of trees in the yard from where they were, and they all remind me. Visiting the burial site, or if there's another place that seems more appropriate, a place that the person liked or enjoyed, or that you spent time with that person. And I love turning the negative into a positive. Volunteer for an organization. I love it when people, instead of getting a lot of flowers at a funeral, make a donation toward a fund to help find a cure for the illness that they died of, or to help other people that are suffering with the same thing. And of course, lighting the candles is a classic one as well. Um, Reading books, photo albums, all those sorts of things can help. If there's any gifts that you got from that person that reminds you, or some sort of clothing that reminds, anything that has that energy for you is a good thing. So getting back to anticipatory stress, and again, this is something that's rather pertinent right now. How do we deal with this fear that we are going to lose something, not knowing how much we're going to lose, or what we're going to lose, or when, any of the specifics? So the first part of this is finding balance in your thinking, not dwelling on the worst, but not pretending it isn't happening either. That kind of midpoint of acceptance. Come to the present. Take a breath. If you're thinking disturbing thoughts, if you have disturbing emotions going on, start with a breath. You can do it anywhere you are, and you don't need anything else with you. Just stop and take that breath and be grateful for that breath. In the case of COVID-19, I found the breathing exercises particularly helpful. We're dealing with a respiratory illness, so taking a breath is an acknowledgement. My lungs are working, I'm in decent health, and being grateful for that. Letting go of what you can't control. We're back to breathing again. Times of crisis brings things in closer. Don't worry about next month. Don't worry about 2 weeks from now. Let's get through today right. Let's just bring the focus down to the things we can manage and can control, and not worry about all that other outside stuff. Stocking up on compassion. There's that old saying that, be kind because everyone's fighting their own battle. Well, everyone's fighting their own battle. And in the case of anticipatory grief, now we have a whole other battle on top of that. And being in crisis can bring everybody's emotions out in different ways. Some people who may be controlling may become much more controlling at this point in time. Somebody has a coping skill that maybe they overuse. In crisis, they will continue to overuse it. It can be very difficult. Crisis tends to bring out the best and the worst in people. So just to wrap all this up, burnout, compassion, fatigue are normal parts of a work life. Differentiating between them is critical. What parts are you dealing with? Are you more burned out? Are you more into compassion fatigue? Because that will help tell you what the effective intervention might be. If it's compassion fatigue, changing a job but staying in the same area isn't going to help. Grief is a universal aspect of life. There are some parts of it that make it more difficult than others, and that there are a great many things. Just in the examples, the short examples that were in the slides here, there are many things you can do to get help for yourself. But most of it involves just being kind to yourself, doing something small, doing something just to be kind to yourself so that you can feel better about yourself, and that reduces your suffering. And as you reduce your own suffering, your level of compassion increases. So there's a lot of really good references on here. I not only included the books and the articles, the material that came from. Burnout is where the anticipatory grief came from, and it's really good. Some classic Kubler-Ross stuff. Judith Viorst's book, Necessary Losses, is fantastic, and put a couple of websites on here as well that will hopefully help you out with that. Thank you for your time. I hope this was able to help. Don't hesitate to reach out if you have any questions, or if there's anything else that we can do to help out. And please check out the rest of the videos in the series on our site. Thank you, and take care.